Has someone you love started showing subtle yet concerning changes recently? Many believe that old age ends suddenly, but the truth is that the body often gives gentle warnings, sometimes months or even a year before life reaches its final stage. The challenge is that these signs are often dismissed as just a part of aging. But looking back, many families realize that the clues were there all along. It was just too late to prepare, to make meaningful memories, or to provide the best possible care. In this video, we're going to discuss 5 early signs that may indicate an elderly loved one is in their final year. Some of these signs might be changes you've noticed but brushed off. Others may seem minor but could signal a deeper decline. Recognizing them early allows you to provide comfort, ensure dignity, and create moments that truly matter. Stay with us until the end. These 5 insights could change the way you support and cherish your loved one during this delicate phase of life. Now let's begin. 1. Noticeable weight loss. One of the first and most telling signs that an elderly person may be approaching their final year is unintentional weight loss. It may start gradually. Loose clothing, a belt that needs tightening, or a once hearty appetite fading away. Losing weight without trying is rarely a good sign. It often means the body is no longer absorbing nutrients effectively. Muscles weaken, immunity drops, and essential functions slow down. Additionally, many elderly individuals experience appetite changes. Their sense of taste diminishes, food becomes less enjoyable, and they eat significantly less. This isn't just a preference, it's the body naturally preparing for a shift. While some families try to encourage eating more, it's important to recognize when the body's no longer responding. Instead of forcing large meals, focus on easy-to-eat, nutritious foods and hydration to maintain comfort. If you've noticed unexpected weight loss in a loved one, don't ignore it. It's one of the body's first signals of deeper changes. 2. Persistent fatigue and weakness. A deep, persistent fatigue, one that isn't relieved by rest, is another key sign. This isn't just feeling tired after a long day. It's a profound exhaustion that makes even small tasks overwhelming. Getting out of bed, walking across a room, or holding a conversation may require significant effort. This happens because the body, sensing its energy reserves running low, begins to conserve what little it has left. Organ function slows, circulation weakens, and muscles lose strength. This fatigue also affects emotions. Many seniors who were once independent may start withdrawing from conversations or hobbies, not because they don't care, but because they simply don't have the energy. If you see a loved one sleeping more, moving less, or struggling to keep up with simple daily activities, it's time to pay attention. Supporting them without pressure and making their remaining days as comfortable as possible is what truly matters. 3. Increased confusion or social withdrawal. Cognitive changes can be one of the most distressing signs of decline. A loved one who was once sharp and engaged may start forgetting things more often, struggling with conversations, or becoming disoriented in familiar places. This isn't just everyday forgetfulness. The brain, like any other organ, needs a steady flow of oxygen and nutrients to function. As circulation weakens, mental clarity fades. They may repeat themselves, forget names, or lose track of time. Beyond memory loss, many elderly individuals begin withdrawing from social interactions. Conversations feel exhausting, loud environments become overwhelming, and they retreat into their own world. Instead of trying to bring them back into conversations, meet them where they are. Speak gently, offer reassurance, and know that even if they don't always respond, they can still feel your presence. 4. Frequent infections and slower healing. As the body begins to wind down, one of the clearest signs is a weakened immune system. Your loved one may start catching colds or infections more frequently, and what used to be minor illnesses now take much longer to recover from. Pneumonia, urinary tract infections, UTIs, and even simple skin wounds may become persistent problems. Circulation slows, which means healing takes longer. In some cases, infections may not even present with typical symptoms. Instead of a fever, you might notice increased confusion or extreme fatigue. At this stage, aggressive treatments may do more harm than good. The focus shifts from curing to comfort. Hydration, skincare, and gentle support can often provide more relief than another round of medication. If infections and slow healing are becoming more frequent, it's a sign the body is struggling to maintain itself. 5. Changes in breathing or circulation. One of the most noticeable physical changes near the end of life is a shift in breathing and circulation. You may notice your loved one's breathing becoming shallow, slowing down, or even pausing between breaths. Some may develop a pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. Poor circulation can also cause the hands, feet, nose, and ears to feel cold or appear pale and bluish. The heart begins prioritizing blood flow to vital organs, reducing circulation to the extremities. Shortness of breath may become more noticeable, even with minimal movement. Sitting up, speaking, or changing positions might leave them winded. Some may develop a cough or fluid buildup in the lungs, making breathing uncomfortable. These changes can be alarming, but they're often a natural part of the body slowing down. Creating a comfortable, peaceful environment is the best way to support them. Final thoughts. These 5 signs, unexpected weight loss, deep fatigue, cognitive changes, frequent infections, and breathing difficulties, are some of the body's ways of signaling that it's entering its final phase. Recognizing them early doesn't mean giving up. It means understanding what's happening so you can provide better care, prepare emotionally, and make every moment meaningful. This is a time for love, presence, and support. It's not about fixing what cannot be fixed. It's about ensuring comfort, dignity, and peace in their remaining time. If you found this video helpful, please leave a comment below sharing what you learned. And if you haven't yet, consider subscribing and turning on notifications so you don't miss our future videos. Your support allows us to keep creating content that informs, comforts, and inspires. Thank you for watching, and we'll see you in the next video.